You've talked about using vacant subway retail space, I guess modeled on what they're doing in Philadelphia, as a place for drop-in hubs, crisis centers, and so forth. Would you be concerned that that might draw more of that population into the system when making the system primarily or almost exclusively about transit is considered one of the paths to just making it livable and usable?
Absolutely. The intent of those of the repurposing of the 75% of commercial units that are vacant within the subway system is one, to connect people to outside the subway system. And I think of it, it's geared to each and every New Yorker who may have a medical emergency, a place that they can actually just go and be connected with services out of the subway system. The system itself is a system to get people around New York City. Mm-hmm. And what we have to ensure, however, is that we are prepared and ready for the questions, the interactions, the experiences that New Yorkers have, because too often we pretend we are still surprised when we have the only person that a tourist can ask about which exit to use is a police officer stationed in that same subway system.
Right.
And that's why I think that we should have transit ambassadors scaled up throughout our subway system so that those same officers can actually focus on serious crimes. And these are the individuals who can answer the questions of which elevator is broken, which line is delayed, which exit to take.
Are you opposed to coercive medical treatment? I mean, this has reached the point where it's been talked about both as policy and as legislation that in some of the encounters that we're discussing, involuntary commitment, treatment, or removal.
You know, I'm skeptical about its efficacy, as I was saying with some of the research that I've read, but I do think it is a last resort. It is something that if nothing else can work, then it's there.
The 911 system, which is really the front door for most emergency services that often gets the cops involved, was supposed to be at least supplemented and in some cases displaced by a 988 system, right? Where you call if it's not necessarily appropriate to bring in the cops. How has that worked in your opinion? And would that be folded into your Department of Community Safety?
I don't think it has worked all that well. I think that there's an issue of inoperability between the two numbers. I think also there are still too many New Yorkers who do not know about 988. And today, if you call 911, you cannot actually you cannot ask for a emergency response that is not the police to any crisis that you call them with for a mental health crisis. And we need to ensure that there's mass education, of which I know there's some. You know, at Steinway Street, my subway station, there is a faded 988 poster right there on the platform. But still, many New Yorkers do not know. And the second is we actually have to ensure that we are providing guidance as to what can be diverted where. You know, this example of Be Heard, of the 35% of calls that even after all of that were still determined eligible and still not taken up. I think it speaks to this question of execution. You know, I think often about, I was saying it's the executive's will oftentimes. You know, in the end of 2021, we had passed significant amount of rent relief that was to be distributed. And when Governor Cuomo was the governor, that relief was stuck. It was not moving. And one of the most impressive things that Governor Hochul has done is how quickly she transformed that program, that, you know, moving at the speed of molasses, into one that was actually releasing the funds. And I just view that as, do you actually want these things to succeed? Because if you do, we can see that what is often described as an ocean liner can go as quickly as a speedboat.
Well, one